They say to me that we are dealing with, meaning the New York State Department of Health is dealing with POPs when they put a paper up on their website which tells people to avoid breathing the smoke from big fires. And I'm sure you know, as well as Lou knows, and I know, and everybody knows that knows about this stuff, that would cause a non-expert to think that, well, that's the main way you get exposed to POPs. It is not the main way that you get exposed to POPs, and you guys know it, I know it, the scientists know it. The main way you get exposed to POPs is eating animal fat or breathing dust from the house. It's got, the PBDs, the permanent flame retardants in it. That seems to be a significant and relevant source of POPs exposure for those brominated flame retardants, but certainly not breathing the smoke from big fires, because how many of those big fires do you encounter in a lifetime, and who'll be dumb enough to stand around breathing it? Everybody knows, nobody needs to be told not to breathe the smoke from a big fire, Nobody's going to do that. So I just kind of feel like that's sneaky, it's just this way of doing something that doesn't do the job. And Dr. Kim said to me, way back in those many years ago, she said to me, I don't know if we want to tell the public about the POPs in the commercial food supply. Because see, we were talking about the fact that the Department of Health does tell the public about dioxins and myrex in the wild-caught fish of New York State and warns them not to eat those. And yet they say nothing about these same chemicals and many more chemicals, because there are many more both in the fish and in all the animal fat. They don't say anything about those POPs in the meat or the milk, the beef and the pork and the poultry that people consume on a regular basis. There's not a word of that. And we're not saying that you guys are any different. It's the way it is. This morning, I was talking to Dr. Angelica Tritcher. She is the top scientist in the WHO's food safety office. And at the end, she said to me, first she tried to say that we had this substantive dialogue. I said, no, we haven't. I said, I've asked you to have a substantive dialogue. I've repeatedly requested it, but we've never talked about the research articles. We've never talked about your interpretation of these articles. We've never talked about a single word of the scientific research. And yet she says, I'm done. I said, I'm not done. I want to talk about the science like a normal person would talk about science. She said, there's no one in our organization that is prepared to speak with you about POPs. This is the WHO. The world's been full of POPs since way back in the 70s for sure. It started in the 30s with Monsanto manufacturing PCBs. How can it be that in 2011, the WHO's food safety entity doesn't have any scientists that can talk to me, a lay scientist? I don't have a PhD, but I've read the literature for years because I care and I'm interested in it. I find it very interesting. It's exciting to know something that's that important about the food supply of the whole world and the cancer risk. So I study it carefully. And yet Dr. Tritcher, she says, there's no one in the WHO that's prepared to speak with you about persistent organic pollutants and cancer risk.
What is it that you expect from me?
I would love it if you would get this one question answered. Will you get this question right here from one of your scientists in the New York State Department of Health? Get them to answer the question, does POPs exposure impose significant cancer risk? I've been trying to get that answer out of everybody in the world. There's nobody in the world that will answer that question that's in government. I get the answer from scientists, they say yeah, but I don't get it from government people.
What I can do is I can give you phone numbers to call the people in Albany who can help you.
But see, I've done it. I've done that.
I can help you here.
Well, if you could write a letter to them saying that one of the residents of St. Lawrence County has requested this answer to this question, that will be you helping me. You can help me that much.
I can call them and tell them you were here.
If you could write a letter, it'd be great.
You can call them.
But I've already called them. I've called them over and over again, and I told you before, earlier in this conversation, that they told me that they wouldn't talk to me. There has to be some pressure brought, and I'm hoping that you would bring it.
It's not my field. I mean,
well, I'm not saying it is your field, but see, you can say to them, all you got to do is write a letter to them saying, one of my people in my district came in, said he was concerned because he's read a lot of science about these POPs and cancer. He would like to have a question answered. That's all I'm asking you to do. Put it in writing.
I'll let them know that you were here.
We'll see if you would put it in writing.
Do you have a phone number or something?
Step. Yeah, 315-262-2456.
Do you have a card or something you can give me?
On that website, my phone number's on there, my address. I don't do cards. The website, got several websites. HASSIG 315-262-2456.
Now, who have you spoken to recently in Albany, or tried to speak to?
I used to talk, the person that I've spoken to the most with, and actually more than that we have exchanged letters, is Dr., well, I don't know if he's a doctor, but it's Robert Chenery, C-H-I-N-E-R-Y. He's second in command in the New York State Department of Health Center for Environmental Health. I've never talked to Dr. Freed, even though I've requested to. I've never talked to Dr. Johnson beyond the point of just asking him to talk to me. I haven't talked to anybody that's got any kind of like role at all in this issue for a very long time. It was way back in 2003 when I talked to Dr. Kim. It's been all that time. And it's because I should have brought it in, but I've got a letter from my assembly member, Mr. Blankenbush, saying, I don't want to do a bill about this. We don't want to be telling the public that there's chemicals that cause cancer in meat that would destroy the economy in New York State. And it's not true. It would not. People are going to keep eating. They'll buy something else. Or the farmers will just sell less fat. They still got other stuff to sell. It won't destroy anything except cancer. That's the one thing it'll destroy. And look right here. Look, this is it right here. This is the point right here. Mission. Working together and committed to excellence, we protect and promote the health of New York through prevention. Prevention and science. That's all that. Prevention and science. I saw that and I thought to myself, that is perfect. If they did that, this would be all going wonderfully. You know, if you guys were using the science that I know, I didn't make it up. It's published in the research journals. David O. Carpenter, MD. Arnold J. Schechter, MD. Robert Moore, PhD. All these guys, all these people that are scientists know the same stuff that I know, and they say do it. They say educate about POPs and the food supply. And cancer. And diabetes and heart disease. You know, I do cancer. They say it's more than that. It's like a complex of diseases. The same chemicals that cause cancer in people's bodies cause type 2 diabetes, cause cardiovascular disease, cause attention deficit disorder. They cause obesity. They cause a huge amount of diseases that we all have, and yet we're not using the science. It's wrong. And I made a complaint to the OIG. Look at this right here. The Office of the Inspector General. Get this right here, Lou. Look at this. Look at this right here. It says to write to the Office of the Inspector General. I wrote to him. And the New York State Department of Health. Let's see now. I want to get this straight. I wrote to the OIG complaining about the fact that New York State Department of Health wasn't educating on POPs exposure cancer risk, wasn't giving a health hazard advisory to the public. I wrote to them. They wrote to Commissioner Shaw saying, respond to this complaint. Dr. Freed, all he did was write a little tiny short letter, a couple paragraphs, saying, we have written to Mr. Hassig over the course of many years, and that was it. As if, like, just because he's written to me, telling me to, you know, that making promises they didn't keep, and even making promises that they're out the window. I don't care. They don't need to only do that. They need to do much more. The truth of it is, that what I had suggested they put in that one brochure, it's that brochure. It's not about cancer. Well, it is, but it's about all disease and all chemicals. Nobody would pick that up in that one brochure. If you put that very, very important message that everybody on Earth should hear, you stick it in that brochure that's about all chemicals and all diseases, they'd miss it. There must be a single standalone document on POPs exposure cancer risk from eating the average routine food of the United States and the world that needs to be published and set before the public in a substantive manner. And we will do as much volunteering as we can to help get it done. But we want you guys to spend some money in it because that's the way everything gets done. You guys could spend some money and do this right and save a lot of people's lives. And it's the time. There's too many kids getting non-Hodgkin's lymphoma around here, and it's one of the diseases associated with dioxin exposure. Way too many kids getting non-Hodgkin's lymphoma. Too many little girls getting breast cancer. That didn't used to happen. It didn't used to happen. It did not used to happen. It's not because of bad genes. It's because of poison in those little girls' mothers' bodies, in those little girls' grandmothers' bodies, and in those little girls' bodies. That's why it is. You know? And we're going to keep complaining to the OIG. We're just going to do everything we can. I feel like I'm going to have a heart attack right now, but...
Don't have a heart attack.
I am strong. Thanks. Thanks for listening to us.